So this is an MRI of a pregnant lady. As you can see, the uterus is showing a baby inside. I wanted to discuss a few points about the safety of MRI in pregnancy and also a little bit about the cord around the neck. MRI is completely safe for pregnancy. There is no limit on at what time of gestation you can image with MRI. Long-term studies, longitudinal studies have shown that there is no risk or harm to the fetus at all, and you can do without gadolinium. If there is a necessity to image an MRI, you can definitely do it. As far as the other things, use of gadolinium, IV gadolinium, again, is not contraindicated. You can use IV gadolinium to do a contrast enhanced MRI if warranted, if the benefit is more than the risk. Very few cases have been reported of skin related issues in fetuses following use of IV administered gadolinium in the mother during pregnancy. But the overall risk of harm from doing an MRI with contrast is negligible. So if it is warranted, yes, you can definitely do an MRI with contrast. So we are not limited by the trimesters, the weeks on when we can scan a baby, a pregnant uterus with MRI. So that's the first point. So it's totally safe and you can advocate for it whenever it is warranted. Next, I just want to briefly discuss about the cord around the neck. Now, the cord around the neck is a very common phenomenon that we encounter in day-to-day practice. So if you are a sonographer or a radiologist who sees a lot of pregnancies, you would realize that in almost all your third trimester scans, you invariably have cords around the neck. Okay, so it's quite common. But whenever there is a couple of loops, 2 loops or more, is when you should start looking at it in a bit more detail. A single loop around the cord, around the neck, a loop of cord around the neck is called a nuchal cord, and the nuchal cord, a single loop is of no significance. This is not in this case. There is no loop actually. It's just on one side of the neck you can see, and then on the other side it's just totally disappearing. Okay, let me see if I can show it to you in another plane. Yeah, not in this sequence. Not in this. I think probably this is the best. Yeah, so there's just a single loop of cord which you can see, and it's not exactly looping. It's just traversing through one side. So cord around the neck by definition is 360 degrees around the neck of the fetus. Okay. Now, how is it significant? Yeah, there is data on 2 or more loops of cord, umbilical cord around the neck, resulting in low birth weight, resulting in fetal asphyxiation and respiratory distress, etc. So in the third trimester, beyond 36 weeks, when you scan, make it a point in your ultrasound to look for the cord around the neck. Now, why is it important is because, as you know, the umbilical cord has veins and arteries. So the veins, as you know, do not have a muscular wall, so they are collapsible. So any sort of tightening around the neck can cause collapse of the veins, and the veins carry the good oxygenated blood from the placenta towards the baby. So that can result in hypoxia, acidosis, respiratory distress. Okay, and there is one entity which some people have called as the tight cord around the neck syndrome, TCAN. Okay, so it basically just means due to the tightening of the cord around the neck, when the baby is born, you can have certain features of asphyxiation visible on the face of the baby and around the neck, probably marks similar to strangulation like contusions, petechial or subtle hemorrhages under the skin, identified in the face, just suffusion, like a little bit of edematous face of the baby, etc. Okay, so that's something called tight cord around the neck syndrome. So make it a point to look at these things, and quite often the obstetrician, the one who's taking care of the pregnant lady, would be addressing a bit more care to the fetal heart rate monitoring in those cases where there is more than 2 loops around the neck beyond 36 weeks. And some obstetricians even prefer to not take a risk and go in for a cesarean section if there is more than 2 loops around the neck. But make sure when you're scanning that you identify the definition of a nuchal cord is a loop of cord 360 degrees around the neck. All right. So these are two things which I wanted to discuss. One is the nuchal cord, and a brief point on the length of the cord. Okay. Normally, an umbilical cord is around 45 to 55 centimeters in length. Less than 40 centimeters is considered a short cord. More than 70 centimeters is considered a long cord. The long cord is often associated with entanglement, loops, because of the mere fact that it's a long cord. Okay, so most of the attributable data available is in relation to long cords, resulting in issues of cord around the neck being tight and possible symptoms of entanglement. Okay, but purely from a theoretical point, the short cords are the ones which are at high risk. So because of if the length of the cord is short and it supposedly is forming a loop around the neck of the baby, that can cause serious risk. But quite often the entangled cords are because of a longer than normal length of the cord.